Moving on to the next question, I am GG or Bust wrote, I have a couple of quick questions about the radiologist review. I guess this fell into the category of it goes without saying, and I know you are being cautious about what you share about the FDA application process before it's complete. But I know many of the investors would appreciate a quick word from the company about the radiologist review. You know, again, I can't really go into detail. I've submitted it. There's a lot of people I've seen on boards that are asking for me to name the physicians. You know, that's just too much information. I think that, you know, once this is all done with the FDA, there might be a little bit more that we'll be able to provide, but it's irrelevant. This radiological review is very important for our process, and the FDA process is very important for us, and we're very close. I don't really want to mess that up. You know, I know that shareholders want more information, but I think that you'll find that of all the public companies that are out there, we're being very, very transparent in comparison. Moving on to the next question. Madison wrote, I saw where yesterday Cambridge Heart got FDA approval after applying only 60 days ago. Why has it taken so long for our approval? That's a really good question. I don't really know the specifics of what it is that they had submitted. It's possible that they've had submitted a 510K, you know, for a year, was denied, and then resubmitted, and then 60 days, you know, had passed, and they were approved. It's very difficult. The FDA has some interesting rules on how they calculate the time of submission, which is probably why the average is so low. Moving on to the next question. Jim wrote, how have you decided to market the product once you have FDA approval? There are several sources of how we're going to market it. It's through print advertisements, through media sources, through the mainstream media. We've done quite a few trade shows. Well, there's a lot of other micro trade shows that we can also be a part of. We also have hundreds, if not thousands, of leads of interested parties waiting for FDA approval. So marketing, you know, we've done quite a bit of. I've been in the medical industry for over 20 years. It's not going to be an issue for us, and this product pretty much markets itself. Jose wrote, I just have two questions. If you believe so much in your product, why are your executives not buying their own company stock? Wouldn't that show a sign of confidence in your company and product? Well, currently, you know, I personally own quite a bit of Imaging3 stock, as do most of the executives of Imaging3. You know, so we're vested. I've also personally loaned this company quite a bit of money, carried this company through some very difficult times prior to being public. So yes, we're very dedicated. The company may, in the future, purchase stock back, but I think the dedication level of this company and its executives is exemplary. Next question, it's a generic question. Oh, Carol, is a 510K for mammography in the Dominion's future? A mammography application is planned for the future. That is a very extensive process with the FDA. That's why we didn't include it with this submission. But being able to image the breast or the chest wall from both sides is very important, and I think it will be a very good application for the Dominion. Moving on to the next question. Investor wrote, have any of the investors in the private placement of securities totaling around 120 million shares from last fall in 2009 sold any of those shares? They became available for sale around April 6, 2010. Well, I believe the total is actually around 107 million, but I have no idea whether they have or have not sold their shares. They're eligible. There's reasons why they probably haven't. The tax for those holding shares for 6 months versus a year is much higher. So I don't know. They may have lifted their legends. It's something I'm not very much aware of. Moving on to the next question. Edzo wrote, shareholder meeting May, June, or July? We're really not sure just yet. Now, to eliminate some of the confusion, this proxy meeting that we're having is really about cleanup. There's no reason why we're trying to delay it other than we're working very hard on FDA approval, and that's a main focus. This proxy statement is just doing cleanup for allowing more board directors, allowing more shares to be outstanding, which isn't really something we need right away. So we have to wait for the FDA to finally rubber stamp it. There's been a lot of back and forth. It isn't really because of anything wrong in general, but the SEC does want it formatted in a specific fashion. We had sent out mailers, letting shareholders know ahead of time before the SEC approved it, and I think we actually did that twice. We're waiting for the SEC to approve it, and it's just a rubber stamp saying, okay, everything's fine in your application, go ahead and have your proxy, go ahead and have your meeting. Once that's done, we'll go ahead and schedule a meeting probably 30, 60 days out so we can give shareholders the time to be able to attend. As soon as we know, we'll send that out to via a press release, via an email blast for our shareholders on our newsletter, and direct emails to shareholders as well. The final question is from ACM, and he wrote, why would Dean propose to sell yet another 2.4 million shares in addition to the 2.6 he just sold if he truly believes approval is imminent? In simpler terms, why would he take 3 million to 3.5 million for his shares when he could potentially get between 10 million and 25 million in a few months? I have never sold any of my shares currently. I mean, there was a program of a 144 program that I ran to help fund the company, but that's all been filed, and those funds actually went directly to the company. What's being addressed is there's a 2.6 million Form 4 that was filed, and there's a subsequent Form 4A that was filed where I had taken a stock loan on the shares. I don't want to sell my shares. I want to keep my shares, and this stock loan allows me to keep the shares and still be able to pull some money off the table to help the company in other aspects. This all occurred because the stock went below 30 cents and the shares were called, so I had to surrender the shares as part of the stock loan. I am not selling shares, don't intend to sell any shares. I believe in this company, I believe in the future of this company and its great potential. So to wrap things up, I really appreciate everyone taking the time to visit our website and visit our investor forum and ask great questions. I'm sorry if I didn't get to answer all the questions that were there and that I'm not doing this as frequently as we had hoped. Primarily, we're trying to do this every couple of weeks because my time is better spent working with the FDA trying to make this thing get through. Also doing some development aspects and preparing the company to move forward. Again, we are very proud of this company for our level of transparency and what we try to provide shareholders. And I challenge you to find any company, public, on any market that provides this level of transparency. Thanks again, and have a great day.